Welcome to week 3 of the Leadership Alliance Professional Development Workshop Series. My name is Dr. Gina Astorini, Associate Director of the Leadership Alliance, and I will be the moderator for today's event. This event is a component of the Leadership Alliance Virtual Professional Development Series. The Leadership Alliance Executive Office and its partners created this initiative to ensure continuity of skill building, networking, and exposure to graduate programs for undergraduate and graduate students from across the country. Paired with our Wednesday evening workshop series, we hope to expose you to a discussion of critical issues, allow you to network with each other and our wonderful doctoral scholars, as well as develop learning approaches and skills for navigating your research careers. This evening, I am pleased to introduce doctoral scholar, Dr. Shanta Whitaker. Inspired by a desire to help and serve the most vulnerable, Dr. Shanta Whitaker left the laboratory bench and academia to pursue a career in public health policy. She is currently a senior vice president in the health policy group at Venn Strategies, a government affairs firm in Washington, D.C. Dr. Whitaker joined Venn from her position at LMI as a health policy consultant to agencies including CMS, where she served as subject matter expert on Medicare and Medicaid shared savings programs, and worked extensively with accountable care organizations. Dr. Whitaker has also been a senior health disparities analyst for the Delmarva Foundation for Medical Care, has served as an editor for the American Journal Experts, and a postdoctoral fellow with the North Carolina State Public Health Laboratory. Dr. Whitaker received her bachelor's degree from Virginia Union University, a master's degree in public health from Johns Hopkins Bloomberg School of Public Health, and a doctorate in microbiology from Yale University. Please welcome Dr. Shanta Whitaker. So let me start off with, as someone who, this was submitted by one of our students prior to this start, as someone who obviously had interests in lab bench work, how do you reconcile that with a position where you don't do that anymore? I know that policy work can produce much fruit in terms of helping people. However, I think I would be dissatisfied being away from the bench side in this more permanent sense.
So, I think it wasn't something that I decided overnight. So I didn't just leave the bench without really thinking about it. So I did my PhD, I did my postdoctoral fellowship. I did a non-traditional postdoctoral fellowship, though. I went through a program that doesn't exist anymore. It's called the Emerging Infectious Diseases Program. That's through the Centers for Disease Control and the Association of Public Health Laboratories. And it places you at the CDC or it places you at a state public health laboratory. And I decided to not go to the CDC. I ended up going to a state lab, and I went to the North Carolina Public Health Laboratory, which is the state lab for the whole state of North Carolina, and it's based in Raleigh. I did applied research. So I was there when, so if everyone remembers, pre-COVID, there was the swine flu epidemic, and I was there. And so we did a lot of testing of samples. We were the first ones to receive the test for the state of North Carolina. And I did a lot of analyses on MRSA, so methicillin-resistant Staphylococcus aureus. So those hospital-associated infections where someone, if it's not correctly treated, could lose a limb. And so that's when I was exposed to public health. And I was honestly getting really dissatisfied at the progress that I was seeing in the lab, just the basic science lab. I wasn't feeling like the things that I was doing would see fruition for several more years. And I felt that public health was one of those fields that would allow me to still use my science training, but allow me to see more of a direct impact at a faster rate. And not to say that academia can't give that to you, but in the particular space and particular slice of the field that I was in, I'm a parasitologist by training. I didn't feel personally that I was getting what I wanted to get as far as that impact from the lab. And honestly, I probably wasn't the best person in the lab either. You know, I made my way through it, but I wasn't like someone who was going to win a Nobel Prize. So I realized that too early on. So it made me think about, like, is this something I really wanted to do? And I spent a good 3 years before I left the lab thinking about it before I made that leap.
So another question from one of our students. What has been the most interesting aspect of studying and working in public health so far? And as follow-up to that, also, what do you think could be implemented in order to better foster health equity for minorities in healthcare?
Sure. So I'll use an example of a project that I worked on. This was my last, it was my last work trip prior to COVID in the lockdown. So I was on a team of, and I work closely with academics still, but it was a team of academics, policymakers, policy drivers, and foundation folks who have expertise in maternal and infant health, because I know that is a huge topic right now, especially on the Hill, and it's gaining more traction, especially since Serena Williams came out and shared the issues she had receiving the care that she needed when she was about to give birth to Olympia. And so I did a whole project on eradicating, reducing maternal and infant health disparities within the state of New Jersey. And what has been a blessing, and this is coming out of the First Lady's office, the program is called Nurture New Jersey. And we drafted the strategic plan. And some of the great things about that has been seeing some of that plan being implemented currently in the state. So, for example, as I'm sure many people know on this line, African-American women are more likely to die in childbirth, or their infants are more likely to die for a myriad of reasons, whether it's not, having bias from healthcare professionals, having not access to care, not the same access to care, not being able to afford the appropriate care, things getting caught late. This goes across all classes, whether you're rich or poor. African-American women are more likely to die in childbirth or from complications to childbirth. And so I was very excited to work on this project because it's been great to see things being implemented in the state currently. So, for example, they just increased funding to get doula support. Doulas are great advocates for for birthing people that are undergoing childbirth. And it's been really rewarding to see a lot of this strategic plan being implemented by the governor, as well as the First Lady's office.
Wow, that's wonderful. We actually have a question from a student that asks about specific healthcare programs such as Obamacare and the benefit to individuals. And how do programs like this affect those who do not need federal healthcare coverage?
I really can't answer that question, I guess. I think part of my project before I came to my current role, I worked on a section of Obamacare, the Affordable Care Act, under the Accountable Care Organization program, which was built to get doctors, hospitals, medical practices to work together to coordinate care for Medicare beneficiaries, because there's a lot of not coordinated care, which ends up costing our country a lot of money because one doctor might be giving this patient X medication, the other doctor that's a part of their care team may not know about this. And then that patient may have a condition or some issue that may pop up from having two medications that are conflicting. And so these accountable care organizations exist to coordinate care. I think that's been a really great thing that came out of Obamacare, as well as having people who may not have had access to medical care or could afford access to medical care have access to medical care.
Yeah. Oh, I agree. So we have a lot of questions that are addressing what was maybe one reason that may have impacted your decision to leave bench lab, or if it was a culmination of events. But I'll also tell you there are questions about that whole transition piece, leaving the bench to the policy area, and what might have been the most difficult part of that transition.
Sure. So, I mean, I'll give a backstory. So, I started off very focused on becoming a medical doctor. So I thought when I entered college that I was going to be a medical doctor. Like you guys, I did several internships throughout my undergraduate time. So the first internship that I did was, it was called the Minority Medical Education Program. I think right now it's called the Summer Medical and Dental Educational Program, exists still today. And I was placed at the University of Alabama, Birmingham. And it was my first time like having that direct interaction with like a cadaver. And so I had to dissect a cadaver. We specifically focused on the thoracic region. And the woman that I had cancer. And so you can really see that she suffered. You could really see where the cancer had distorted her body. And that part freaked me out. And so I came back thinking to myself, like, what am I going to do? And my advisor at the time, he's a microbiologist by training. And he's like, well, have you thought about a PhD? And I was like, I hadn't. And so from that point on, I learned more about doing a PhD. I learned more about the PhD in microbiology, just because I really liked microbiology. That was the class I really loved, undergrad. And I did internships. I did one at the University of Alabama. I did one at the University of California, Berkeley. And then I did the Wonderful Leadership Alliance program in my junior year of college in 2001 at Brown. And that was in a totally different area. I did physiology, but I did it as a way to see like if the PhD process was really what I wanted to do. And so when I went straight from undergrad to a PhD program, I went to Yale, I did a PhD in microbiology. But I think during that time, I started to not necessarily feel like that was the path for me. But at the time, I didn't have like people coming to speak to you guys like how you have right now, and a lot of other sessions like to learn, just of alternative careers. So I kind of just stayed on that path, unsure what to do. I did start auditing classes when I was a PhD student. I took one by Marcella Nunes-Smith, actually, who was on the Obama administration for the COVID task force. She taught this wonderful class on health disparities. And so that was my first exposure to health disparities. And I was like, oh, wow, this is really interesting, but I couldn't see how that could be a career. So I kept on the PhD path. I finished my PhD. I didn't want to do an academic postdoc just because my advisor had scared me about just seemed like she had to put her life on hold until she became tenured. And then, a lot of my other fellow classmates decided to do alternative routes. And so I did do a postdoc, but during that postdoc, I started to think about what I wanted to do. And again, the path is windy. There's never like a set thing or a aha moment that kind of like directs your path. I would have never thought I would have been in the role I'm in now. I didn't plan for it. It kind of just happened to fall in my lap. And I feel like when I left my postdoc, I sort of told myself, if I stay in academia, then I'm not really leaving academia. I'm just not at the bench. And so when I first stepped away from the bench, I was in academia still. And I worked at Yale College. I worked there for 2 years, and I worked with undergraduates who were trying to figure out their careers and figure out what they wanted to do with themselves. But I also used that time, because it was the most time I've ever had in my life, just to have free time to just think about really what I wanted to do. And I talked to people, I did informational interviews. And at the end of the day, I ended up deciding to go back to school. So I went back to school after my PhD, and I got a master's of public health. And that sort of set the trajectory. But I will say, since I've been in public health, the path has been very windy. Before he passed away, several years before he passed away, Representative Elijah Cummings, he came and spoke to my class because he was the representative for Johns Hopkins, and he came and he gave this talk, and his last words stuck with me, and they still stick with me to this day. And he said that you should let your passion fuel your purpose. And so I've kind of looked at my career in that way. I've kind of pursued positions where I feel like I'm passionate about, where I feel like I can make a difference. And so while I'm in my current role, it wasn't the plan for me to end up there. Like, I wasn't working towards this role. I kind of was looking for a job, and it looked like it would be a good place for me to grow and gain a good skill set, and to sort of start, continue that path of having my passion fuel my purpose.
Thank you. That was really incredible advice, very motivational. We have a question from one of our audience members. Aviva would like to ask, if you would have had the opportunities to see public health careers earlier, would you still have finished the PhD? Yes, hands down. I do not regret doing a PhD. The only thing that might have changed is just the focus area of what I've gotten my PhD in, but the PhD itself, even though I'm not at the bench, it is a skill set that is seriously needed in a lot of professions. So I'm right now, I'm in a government affairs shop. And for those who are not as familiar with government affairs, that basically what people usually think of us as is lobbyists. So, and when you hear the word lobbyists, you think, oh my God, these people are going and like doing bad stuff on the Hill. But lobbying in the sense is that we serve as educators. So we serve as educators to members of Congress, to their staff. We serve as educators to the administration. So whatever administration's in power. So currently, the Dems are in power. So anybody in Joe Biden's cabinet, we're, trying to, make sure that they're aware of the particular issues that are important to smaller organizations that may not necessarily have the ear of the president. We're engaged with, the NIH, the FDA, the USDA, any agency that has ability to have any form of policy control in the United States. And I do that at the federal level. So all the work that I do is focused on national policy. I do have some outliers like the project I mentioned that was focused in New Jersey, but for the most part, the work that I do touches health nationally. And the PhD, which is very useful, I'm the only PhD in my office. And the PhD is super useful because I think people discredit, some of the things that we learn as a PhD. Like, you're able to basically take complex concepts and break them down into layman's terms. Super useful, especially for policymakers. I'm able to do research on anything. You also learn how to write very well when you do your PhD because you have to write that long dissertation, as well as scientific papers or other publications. And your thinking, the way how you learn how to think, and any MD would tell you this, that the PhD and how you learn how to think as a PhD is invaluable. And so I'm able to apply my PhD brain to a lot of strategy, and it helps me to think of things and see things in ways that my colleagues who don't have PhDs are. Yep, that's wonderful, wonderful examples. So we have a question from a student who would like to know, so your background in health policy and that relationship with health equity, what examples have you seen of research that was done that eventually was used to back specific healthcare policies? I'm trying to think. I mean, I know, so for example, with the opioid epidemic, there's a lot of publications that have come out, both at the, translational science piece, as well as some of the basic science piece.
that has been translated to, fighting for why, for example, that people become addicted to opioids, why people are, what are the alternatives to opioid use? How can we advocate for better access to things that will not allow people to get addicted? But you can see it across the board. I think people will pull data points from the literature, especially in the science and medical fields, as well as the public health fields, to use that as a rationale why things should change. And those things are often brought to staff all the time because, for the most part, members of Congress don't have time to sit and read 10,000 things that people send. Their staffers will take that information, they'll digest it, and then they will let their, who they work for know like the most salient points. And you can see that across the board for a lot of disease states. So, for example, for diabetes, that impacts minorities at a higher rate. There's a lot of data out there, and you can find data specific to the states, and then you can target members and have that information shared with them specific to their state so they understand what's going on, why this is important. And you see that too with some of the legislation that's coming out right now on maternal health. There's a lot of, right now, the big push outside of, that's been very interesting to watch is this whole drug fee user authorization process, which is called PDUFA. This happens every 5 years. It's a must pass. So when I say must pass, it's a bill that legislation must pass. Otherwise, it just has to be passed. And it's coming up on September 30th. And this sets the tone for drug pricing. It sets the tone for, I know people are starting to see a lot of stuff around clinical trial diversity. There's a lot of legislation on that included into this big PDUFA thing. So it's very interesting to see how data and, public basic science, as well as translational science and clinical data all get, basically translated, shared with policymakers to then influence how these legislation pieces are coming to people. And plus, people like us, scientists, medical doctors, physician scientists, all the full spectrum of researchers, whether you're a clinical researcher or a basic science researcher, often go up on the Hill and educate members directly.
Wow. Okay, so what would you say is the most pressing issue in public health policy today?
Well,
it's a hard one.
about to say, at the moment, I'm sure everybody knows, what's been in the headlines. I will say it's in my book, it will not be named just because I don't feel like it's such a polarizing conversation to have. But as everyone knows, Roe v. Wade is the big thing right now. Contraceptive rights, reproductive rights, those are what is the flavor right now. And that is what's being talked, that and gun violence, gun control, those are the two big pressing issues currently.
And what is your opinion on whether public health policies actually and accurately reflect medical knowledge and practice? And thank you, this person added.
See, I think this is where the problem is. Everyone, there's always two sides. There's people who fundamentally believe in one thing, and then there's always another group that doesn't believe in that one thing. And then both groups will have their data or that they have to back up what they believe. So it can be hard. There are certain things that I see that are coming down the pipe around legislation that I don't think are scientifically sound. But there might be a bigger party of people on the other side that like it and they'll push for it even more. So it's kind of hard. So I think it's definitely very, unfortunately, unlike science, how science is very exact, very black and white. It's not very black and white in the policy space. It's more in a gray space. So you have to kind of navigate that and, just make sure what you support, I feel, is scientifically sound, but not everyone believes that, I will say.
Yeah, that's been evident, I think, just in the past 2 years and that whole debate, right? Okay, so going back to the skills that you were talking about a couple of questions ago regarding what the PhD has brought to your career. Audrey, one of our guests, as a PhD, when you speak about thinking differently, can you elaborate on this? Does this affect how you read literature, research topics, think about solutions, or something else?
Gotcha. So when I mean think differently, so when I read the literature, I read it as I'm trained as far as like, the digestion, making sure that that the results are sound and the data is sound. But I now look at it through a policy lens. So if I'm reading a particular paper, I'm looking at it from the lens of, okay, what are the pieces that would resonate with a policymaker? What would move the needle on certain things? When I talk about thinking differently compared to my colleagues, what I'm saying is because of the training. So just think about like how we get results in the lab. Or, as we, think about things as social scientists and try to uncover, pieces and how we want to correlate them to fit, our research questions that we're trying to answer. I think because of the PhD training, I think I approach strategy differently. So I tend to think very high level. I can get in the weeds too. And pick out the nuancy issues that some of my partners that may have like law degrees may not see. But it's a mixture of things. So, I definitely read the literature the same as everyone else. I definitely, as everyone on this call is being trained to do, and you will be trained to do as if you get a PhD. But I think it's the translation piece. So when I am able to read, I translate it based off of what is salient to the work I'm doing. So it's sort of like how, you would translate scientific publications to, you're digesting them because you're looking for backup information for, how you're going to run an assay, how you're going to support the work that you're doing, have validation for data. It's the same way, but it's sort of like pulling that into a public health lens, into a policy lens. And that is unique. You may not feel like how you're learning is unique, but if you talk to other folks in other spaces, your brain works differently. So that's very useful. And it gives you more of a diverse view of how to approach a problem.
Yeah. Oh, so well stated. Thank you. So in your experience, what has been the most challenging aspects of public policy change? And if you knew then what you know now, how would you have adjusted your path to be more successful?
I don't really think I would have changed anything about my path so far. I think I have a very solid understanding of how our country runs, which is something that people don't necessarily get a perspective of unless they're really in the weeds of either working for a member of Congress, working on the Hill in some other aspect, or working in a government affairs firm. I think I have a better understanding of how our country runs beyond, like the government classes we take in high school or college. And I think it can be very frustrating, honestly, about like just especially how polarizing both parties are at the moment. It's hard to find these middle grounds. But I do think it's very exciting to know that I'm in a position where I can help clients that I work with make, public health policy better and make, and in turn, hopefully make our country better. So that for me is exciting. And I know as I continue to grow in my career and go, continue to grow and go elsewhere, that I will continue to have that experience and that feeling. So for me, it's rewarding. I don't have any regrets. I wouldn't change anything about my path because it's, my path is my unique path.
That's so great. We have a question along the lines of maybe health economics, which is a really growing, I'm not sure, but this student asks, adjusting capital gains tax rates are argued as one path to reduce income inequality. What are the current perspectives on taxing unrealized capital gains? For example, 1% in excess of 50 million. Is this a potential solution to make the tax code more progressive and reduce more income inequality? And if so, which organizations are leading these efforts? I know it's a lot.
Yeah, I'm not really sure I can answer that question. That's out of my spectrum of work. Like I don't do anything with income equality. Okay,
great. So another student has asked, how did your undergraduate background in microbiology and the hard sciences inform your decisions that you make as a senior vice president in health policy?
So I feel like anyone who's in science, whether it's, physics, biology, whatever, I felt like my PhD process, while it was very supportive, it was very direct, I will say, meaning like I see like what I've learned from my PhD process and how that makes me now like in a career outside of science to be. So for example, when I was a PhD student at Yale, we had these things called research in progress. We had to do them twice a year, and you basically present your dissertation research to the whole department, and they could rip you to shreds. So they spend, a good 30 minutes ripping you to shreds, going through your work, telling you why this sucks, that kind of stuff. So, it's a humbling experience as well as it's an experience that helps build a strong coat, I will say. And I think for me, and this is one of the things that my company has been they have called themselves, trying to teach me not to do, is that I'm very direct. So when it comes to things, I don't sugarcoat them. I see things very black and white, which again, like I had mentioned, policy tends to be on the gray spectrum. So I've had to learn how to navigate the gray spectrum a little bit more because I see stuff as right or wrong. Like there's no in between for me. But there's an in between for policy. And so I feel like the PhD process though made me very strong, made me to be very decisive. So when it comes to decisions that I have to make at times for client work, I'm very decisive. I, weigh all the facts that are presented to me, and I'm able to come up with an educated decision on the path forward. And I'm very good at organizing people, as everyone will experience if you haven't done your PhD process with organizing your committee. I've had to, it's like wrangling cats sometimes. And I feel like at times it's just wrangling cats and making sure that everyone is going in the same direction. And I feel like the PhD process was very helpful with that as well.
Thank you. So I believe you're the perfect person to answer this next question. Do you have any advice for individuals wanting to work as a doctor, carrying out research at the intersection of public health and clinical care? And would you suggest potential MD, PhDs to do their PhD in public health, or would a master's be more fitting?
It just depends on what a person wants to do long term. So if a person wants to, helm a huge research lab, I think it's possible with just an MPH. You would just have to do a postdoc. So MDs do postdocs in research. One of my colleagues, one of my closest friends, she's an ear, throat, and nose surgeon, and she has an MPH, but she also did a postdoctoral fellowship. She did a postdoctoral fellowship during her residency, which tacked on some time, but it gave her the foundation to then have her own clinical public health practice research program that she does. So she focuses on health disparities within hearing and Alaska Natives. So she does a lot of research where she'll go up to Alaska, she'll provide pro bono clinical care, but as well as doing the data analysis. So she didn't do a PhD. She just did an MPH as well as a postdoctoral fellowship. The PhD, I feel like, is one of those things. If you're an MD, you really have to weigh out, like, what is the purpose of doing the PhD? Like, are you going to ensure that the PhD process that you're getting is equitable to a PhD that, you know, a regular PhD program would be? Because I feel like some cases, the PhD for the MD PhD is shortchanged. Not in all, I don't feel like that's the case in all institutions or whatever, but I do feel like some what I saw from my experience was that some programs kind of fast tracked their MD PhDs. And so they didn't really get that full experience of how to really address a research question. But the ones that have truly used their MD PhD in a really great manner, I'd say probably one of my other colleagues, he's an infectious disease physician. He does AIDS research. He has his own lab, but he also still does clinical practice. So he splits his time between having his lab and having the clinical practice. And he has graduate students and medical students. And so I think you just have to weigh exactly how you see yourself intersecting with public health and what would be the most beneficial to you in your career. Obviously, of course, doing an MD, MPH is a shorter time commitment compared to doing an MD, PhD. So it's just a matter of weighing how you plan to use it. But if you don't plan to do research at all, there's no point of doing a PhD. I feel like you can have a strong clinical practice as well as get into some of that community public health work by doing an MPH.
Thank you. Dr. Whitaker, from your graduate school experiences, do you think gap years are more helpful or hurtful to students who plan on acquiring higher degrees?
I think it's going to be based off of your personal preference. Like, you know, in hindsight, I wish I would have taken a gap year because I was burnt out by the time I finished my PhD, because I had basically been going to school since, you know, pre-K through, you know, my PhD. And so basically until the age of 28, I was in school. And so by the time I got out, I was exhausted. It took me a good 2 years to come back from the level of burnt outness I've had by going straight. However, you know, I thought to myself, if I didn't do it that way, I wouldn't have probably proceeded. I think if a person takes a gap year, I mean, you just want to make sure you have a designated plan for yourself. Like, you know, what is the ultimate goal? Like if you're taking a year or 2 years off, you know, do you have a timeline set out to yourself of when do you plan to go back to school? What you're planning to do in your gap year. Otherwise, you could look up and be, you know, 40, 50 years old and still haven't went back to school to get the degree that you said you wanted to get. So I think if you map it out strategically and really take advantage of your gap year, it's a great thing. But it's also great to go straight through if that's your preference. I'm glad I did. I mean, even though I wanted a gap year, but yeah, I was still burnt out. So in hindsight, I probably could have took a gap year because I had the definitive plan that I was going to go to grad school and I knew where I wanted to go. And I could have potentially deferred a year.
Right. So last week, we had a webinar on the imposter syndrome, and there was a lot of student questions and activity and discussion around that particular webinar. So we have a question that asks, can you talk to us about how you have overcome, well, first of all, have you experienced those imposter syndrome feelings? And if so, how did you overcome the doubt and were you able to balance with the important work that you're doing?
So I don't think imposter syndrome goes away, unfortunately. It's one of those things, if you ever struggle with it, it's something that will pop itself back up, you know, from time to time. So I'll give you an example in full transparency. So last year, I was promoted to senior VP. I was a VP for the first 2.5 years that I was at my company. And then I got promoted, which surprised me, number one, because I had talked to my CEO and I was like, okay, you know, where do you see my next step going? And, you know, she asked me what was important to me. And I was like, financially, you know, money is more important to me than promotion, but I knew I was on track to getting promoted. I just didn't think it was going to happen that fast. And so when I got promoted last year, I was immediately hit with this, like, oh my God, do I really deserve to get this promotion at this time? Do I really stack up compared to the other senior VPs at my company? At the time, we since brought on one woman, but at the time when I got promoted to senior VP, I was the only woman senior VP at the firm. And so I was like, oh my God, like, do I really belong here? But, I had to check myself. It's like, you have to remember, like, what are the wonderful qualities that you bring to an organization? You're not getting promoted just to get promoted. You're not getting X thing because, to get X thing, you're working hard. You're doing, the best that you can. And it also helped, honestly, to talk to friends and other colleagues that are in the space, either those who are in academia, those who, know me very well, just talking to them and just, being able to get out how I feel. But I think, imposter syndrome is one of those things. And unfortunately, I see it a lot among women of color, tend to have it a lot. And that doesn't matter how old you are. Like, I'm in my 40s at this point, and I still have it from time to time. And it's like, I have to remind myself that I belong and that I shouldn't sell myself short. And that I shouldn't take myself out the arena. I should have let someone else take me out the arena. So those are positive self-talk things that I have to do on a regular basis to not allow that to affect me.
Right. Yeah. So there's a lot of discussion around how to prepare for when you're the only person who looks like you in a group and in an organization. And you talked about the idea of having people to talk to. So like a set of mentors or friends, or can you speak to a little bit?
I usually talk to friends. I bounced a lot of stuff off my husband. And when I was single, I would bounce stuff off of like my close network of friends. And potentially I wouldn't necessarily talk to colleagues, but I would talk to folks that I knew that were in similar spaces that I knew from like school, or that I knew from programs like the Leadership Alliance that I kept in contact with, to have those discussions. But I wouldn't necessarily have those conversations in the office, but I would have those conversations with, people in my network that I feel comfortable with. And, the Leadership Alliance, honestly, y'all, I'm giving a plug, is a great network. I still keep in contact with several folks that I did my Leadership Alliance program with, and that's now 21 years since I've done the program. So I think, just, look around, your pool will get smaller. You'll keep seeing the same people over and over again as you continue along your professional journey. And those people can serve as really good sounding boards as you move along your career.
Oh, that was such great advice. Thank you. So another student has asked, what advice would you give to your past self? Maybe to you as an undergraduate or you as a graduate. What piece of advice would you might share?
I would probably just tell myself to continue to do things afraid. Like, I think for the most part, I'm kind of odd in the sense that when I was undergrad, I was super sure of my path. Once I decided I wanted to do a PhD, I was super laser focused. So I was determined to get into a great school. I was determined on having like the best essay, the best letters of recommendation, just having the best research. So I was super laser focused. So I think, and then when I came into my PhD program, I was super laser focused as well, initially. And then I got kind of derailed by a class I took my first year, but that's another story. But I think the only advice I would just tell myself is just, continue to, explore what's out there. I think the benefit of things like this, and I know now at Yale, they're doing this program for grad students called Where Do I Go from Yale, which helps PhD students see what career possibilities are open. I didn't really have that exposure. So I kind of had to learn it as I went along my path. I was interested in health disparities when I was a PhD student, but I couldn't see how to pursue it as a career. I didn't think it was a viable career. And so having the opportunity to just do informational interviews with people, talking to people in your network that are doing great things, talking to alumni from programs like this that might be doing good careers that you might be interested in, even if you're not thinking about leaving your current path, it's very helpful because it gives you exposure and helps you think about your career in a new light. And I wish I had that. I wish I had a little bit more career exposure when I was younger, because I think I probably would have, journeyed along my path a little faster. But, my path is my path. So I have to embrace my path.
So drawing upon that answer, how do you reassess your goals? How do you do that? And do you have your next set of goals ready to go?
So I think, I feel like as you continue to go up in your career and become more senior, you have to be a little bit more strategic and think about your goals long-term and short-term, as far as like, where do you see yourself professionally? What do you want to be when you grow up? Because I feel like you're technically, I feel like I'm still growing up. And so I ended up, I'm working now with a career coach, and I'm just thinking about like my next steps, where I see myself going, what are my goals, what are the things that I want to accomplish in the next 3 to 5 years. And so going through that exercise, seeing what makes me passionate, doing those gut checks for myself. Like, again, I still hold to that mantra that Representative Elijah Cummings said, let your passion fuel your purpose. And I want to make sure that the career path that I find myself on continues to meet that metric for me. And so it's a lot of digging. It's a lot of reassessing. I do a lot of thinking about where I want to be professionally, personally. Those are things I constantly think about. And I don't feel that I'm ever going to be in a position where I allow myself to get comfortable in a position that I'm at and think, okay, this is it. I'm always thinking about, what is the next thing? How can I continue to grow in the current role I'm in? What is the next step for me?
Thank you. So are there other fields of study or discipline that have informed your work or your career path?
Yes. So when I did, I'm a non-traditional PhD in the sense that I got we got a master's on route for my PhD. I got a master's of philosophy. I tend to forget it sometimes just because I didn't even go to the graduation. I picked up the degree and I was like, the ultimate goal was the PhD. So I wasn't really thinking of it. But I did go back to school after my PhD, 4 years after my PhD, and I got a master's of public health. And the master's of public health really informs a lot of the work that I do now. Everything from, the health disparities classes that I took, the epidemiology classes and biostats classes that I've taken, to the policy classes and chronic disease classes that I took, as well as some of the research that I did while I was there on health disparities and social determinants of health. So all that work informs my current work, especially with Continuum Health, which is a part, it's sort of an organization that my boss and I started that lives outside of Venn Strategies, that's focused on population health disparities and policy. We don't do lobbying on that side. And we work with a lot of organizations that are not interested in lobbying, that are interested in just having a policy point of view and helping them think through that. So that work definitely is informed by my master's of public health.
Thank you. So there's a question that says, do you feel these programs actually help the vulnerable?
So like the Leadership Alliance?
Maybe it's I'm thinking it's public policy programs.
I think some of them do. I mean, I do think there are some that are really, really good that do make impact. So sort of like some of the state level programs that I discussed for New Jersey, implementing reimbursement for doulas is big because, a lot of women don't have people to advocate for them when they're going through childbirth, and that the doula serves as that gateway to do that. I know several years ago, for those who have insurance, contraceptive care was covered, and you didn't have to pay for that out of pocket. So that definitely was a policy change that benefited a lot of women. Here in DC, I know they removed taxes on, menstruation care. So, things like that benefit populations. And I know there's a lot of reform and stuff that is going to be coming down the pipe, especially in the wake of COVID, with public health being realized that it's important, it's important to have public health programs. So I think hopefully they'll get together with monkeypox, but we'll see. But I do think there is a lot of things that have been passed on the Hill that are directly beneficial and trickle down to helping people live better lives.
Great. So there's a question, I'm going to probably paraphrase this a little bit. How have you balanced what is required in your work? And it's a supplemental work, but I think it might be like requests to do other work beyond what your current job may require of you. How do you
repeat that one more time?
Yeah. The question reads: how have other fields of study informed your work, and if so, how have you balanced what is required in your work and supplemental work? So I'm kind of interpreting that to mean that we all have our job, our focus, but then you're asked to collaborate or do something beyond. And I guess maybe how do you balance that?
I feel like there's really nothing outside of, I'm senior enough where there's nothing kind of outside of the spectrum of things that I can look at that would be out of my scope. Like, of course, there are things, some stuff I read just for educational purposes. So like right now, me reading on monkeypox and looking at that information is, totally nothing that I'm working on right now. Could it be something I'm working on? Potentially, who knows? There might be a client down the line who might need to have some sort of policy agenda or education piece for the Hill that's related to monkeypox. It just depends. So I do a lot of reading based off my own interest, but a lot of, research. I still do research based off my own interest, but it, again, because I'm senior enough at my company, I have that leeway. So I have time to do work, of course, related on the topics that I'm focused on. So like right now, focused on precision medicine, I'm focused on maternal health, I'm focused on FDA drug policy, and I'm focused on diabetes. So I read within those spectrums. I do work within that spectrum, but I also read stuff, and that's part of the business development piece, because you want to know what's coming down the pipe. You want to know what's out there. You want to know what's hot. So I do a lot of outside thinking and reading. So
I would say that that's how you're in the field that you should be in, because your passion is that area and nothing feels outside of your scope of interest. So I totally align with that. So we're going to ask one more question, kind of out there, but I think inquiry minds want to know, what is your favorite food?
Oh, that's hard because I'm a foodie. Like I will travel for food. Like I'm that person, but I'll also go to the hole in the wall for good food. So it just depends on the given moment. Like when I was in New Haven, I like pizza. So my favorite pizza place is Pepe's, and they had really good pizza. And you ask me on another day, I might want a burger. You ask me on another day, I might want seafood, but I love food. I eat a lot of food. I probably spend a lot of money on food. I really like food. So
Thank you. Thank you so much. Would you like to make some closing remarks? I think we've
Sure.
had so many questions from students. Hopefully, we've covered everything that you would have liked to share with students, but let me give you a few moments.
Sure. I would say the one piece that I'm very surprised that no one asked about was like the whole work-life balance and making, time for your own interests. I feel like I've been asked before about like, being able to have balance for marriage and, having balance for like other relationships, your friendships, your whatever else that you do. And I feel like, as you continue to go up in your career, you have to make sure you have that balance where you make time for yourself outside of work. Like you also have to have identity outside of the work you do. So taking time to invest now in what makes you happy outside of work. So as I mentioned, food is one of my things. I cook, I bake, I love to travel. Relationship wise, I was one of the older spectrum women getting married. So I was 40 when I got married. So, there's a whole bunch of, stuff tied to that. But I will say that, just making time for your own life because, your career, unfortunately you have to remember, life is short, and your career will continue on when you're gone. So, what are the things that make you happy? Making sure that you're taking time to do the small things that bring you joy, making sure you're taking time to protect your own mental health and doing those things to keep your mental health healthy is super important. Your physical health is super important. Just doing those things to, just care for yourself, I think is very important. So I just hope, as long as you guys are traveling and, doing great things academically and doing great things professionally, that you also remember to have fun outside of work and that you take time to do the things that really make you happy outside of work. And I think that'll probably be it. And I did put my Twitter handle as well as my work email in the chat. So please feel free to reach out to me if you have any questions. I am open, I'm here. I'm willing to answer questions. I will respond, maybe give me a few days if I don't, but I will respond. But I'm here to help, to support, because I was in your shoes 21 years ago. I can't believe it, Jesus. And I'm here for you. Leadership Alliance is such a wonderful program, and so happy for you all that are getting a chance to do research this year. So it's been great talking to you guys.
Thank you. Thank you so much. Thank you on behalf of the students, administration, for your words of wisdom. It's been inspirational and motivational. Absolutely. It's been wonderful. And I believe we all wish you the very best with your next career steps, whatever that may be. And thank you again. Students, please remember to join us on Wednesday when we will talk about pathways to health equity.